It's a pleasure and honor for me to be here and be making a presentation at this very important gathering. I want to appreciate the organizers for giving me the opportunity. I'll be talking about the situation as it is in Africa, but mainly focusing on the East African region where I'm coming from. The outline, just quickly looking at the drug situation, the regional initiatives that we have, national programs, particularly the case for Uganda, and we shall conclude. Now, as I sit in this room, really, I can't avoid thinking about the issue of the drug abuse situation as we see it globally, because it continues to increase, continues to give us problems, and this is the reason we are here, so that we can see how best we can put our heads together and probably come up with a situation that is more acceptable. Looking at the World Drug Report for 2015, it indicates an increasing problem of abuse of drugs globally. Of course, with the now even multiple health consequences, HIV coming on, hepatitis C, and many other problems. We hope that by the end of this meeting, or probably in the next World Drug Report, the situation will be better, because we are coming up with better ways of dealing with problems, better ways of treatment, and better strategies to do the control. Trafficking is an issue that continues in various products. We see heroin coming from the Middle East and cocaine coming from the other side. Africa, we are stationed in the middle. We keep getting from either side. Our main problem has been cannabis, which we consume, we produce and consume heavily, like we shall see subsequently. Now, Africa, like many of you know, initially we thought the drug problem, especially with the major illicit substances, was not an issue, because we were producing the cannabis and consuming it in a mild way or moderate way without major consequences. But now we cannot say any longer that we are only having cannabis. We are currently having global challenges due to changes in the politics, the culture, and so many other things. The continent has been transformed from what used to be a consumer or a moderate user of local substances to illicit substances which are consumed and also trafficked. We have issues with the data, like somebody alluded to this before, that we don't seem to have good data on the continent. Not necessarily that there is nothing completely, or that people are not doing any studies. We are doing some studies, but sometimes, unfortunately, these studies are not well disseminated. And you know, research, if done and not shared, not disseminated, is not helpful. It doesn't improve practice, doesn't inform policy. So I think what we need to do is encourage our people that are doing the research to do more dissemination. But even what we are doing is not enough. I think we could probably do better. We can do more research. That is still a big issue. We have had arrests for traffickers being relatively low compared to our other countries, friends, where there are clear mechanisms for dealing with the traffickers. The governments in our countries are not doing much, probably because of other competing needs. In terms of providing resources for drug abuse prevention and treatment, some countries, some governments have not been very, very comfortable with that. They would rather deal with other competing problems, malaria and so on and so forth. So the traffickers take advantage of this. The consumers increase because there are more coming in. People are not being deterred from bringing drugs into our continent. Consumers increase for that matter. Then what is also disturbing, yesterday we were looking at a situation of trying to help delay use of drugs by young people, because the earlier they start, the more complications they get. But what we are currently seeing is that there is a decreasing age for first use of drugs by young people in our countries. Previously, probably we were saying many of the young people started using drugs when they joined secondary school. It's about 14, 15, 16, 18 years, but now we are seeing young people beginning to use drugs even at the age of 6, 7, and 8, which is really worrying. Then we see that the price of the hard drugs is going down. It's going down not because the drugs are generally cheaper, but unfortunately, the pushers are becoming very, very tricky. What they do, they provide for everybody. We have the expensive drugs, and we have the cheap ones. The cheap ones are the adulterated forms, which are very, very dangerous for our populations to use. Now, of course, other challenges continue. The vast and porous borders at the coastlines, which are long and not well manned, the poorly regulated airfields. It's easy many times in many countries for traffickers to pass through the airports with the drugs, of course, entering the country and sometimes going out. The weak government infrastructure and limited law enforcement capacity have made sub-Saharan Africa a hub for traffickers, like I said earlier. Then we see that because of these wide coastlines, areas, South Africa, the eastern coast, the western coast, people, traffickers very, very easily get in. Now, that said, Africa faces many other challenges, many other problems. Poverty is real. You all know that poverty is a common problem in our area. In many countries, probably 10–15% of the populations live below the poverty line, which is really quite heavy. And when there is poverty, there is redundancy, there is unemployment, so that fuels drug abuse. HIV/AIDS is a problem on the African continent. You are all aware many countries are grappling with this very, very big burden. But before, we thought that all our HIV/AIDS transmission was heterosexual, but I think now we realize that we are having lots of other factors, one of which is injecting drug use. It's fueling the epidemic of HIV/AIDS. We see in many countries where people are injecting, the injecting drug users have a very, very concentrated epidemic. In many countries, over 20–30% of injecting drug users are HIV positive, which is not a very healthy situation. Then we have the endemic diseases also adding to the burden. Malaria and many other tropical diseases have caused a lot of problems. Then civil strife. At any one time, you know, in Africa, there are about 10 countries in conflict with neighbors and internally and so on and so forth. And all these, the product or the result is that there will be an increasing drug problem. This is the cycle of course, poverty and the drug abuse, which we know about relating. You can't keep one from the other. They really tend to go together. The common drugs that are used in our places, cannabis, like I said before, is the commonest drug of abuse. Cannabis in the tropical environment, you all know, grows very well, widely, sometimes it's even cultivated, and you find it's all over. You don't have to put in a lot of effort in growing cannabis. So we produce, we consume, we export a lot of it. Cat is another. We talked about this yesterday, containing cathinone, CNS stimulant. It's heavily consumed, especially in the Horn of Africa, but it has spread almost the entire continent, even inland. Heroin and cocaine have come in. They are now part of the drugs that we are using, of course, in different ways, including, unfortunately, through injection, which is very unfortunate and also fueling the HIV epidemic. Amphetamines are there, sorry. Organic solvents, quite used, and the prescription drugs, mainly here, the benzodiazepines, the phenobarbs, and the things like pethidine and morphine a lot used. Now, when we look at why our people are using these drugs, various reasons that you all know about, but just to point out these few, a lot of them are using for self-medication, pain, stress, and other mental health challenges. Like we've been seeing comorbidity or other issues that people may have, and they continue to use, they start and use drugs and keep there. Some are to adapt to a new life in a new environment. Maybe they're internally displaced out of conflict and other things. It's coping with the suffering, various forms of suffering, poverty, and other forms of difficulties that they may be going through. The wide availability, like we said, once a drug is available, it becomes easy for people to access it. They'll take it and, of course, and eventually abuse it. And the low cost, things like cannabis are extremely cheap. You don't even need to be employed to afford it. But also these other hard drugs that are coming in, some of them adulterated, have been made so cheap and accessible by our populations, which is not a good thing. Then the control is clearly poor. We don't have very good control that one can talk about. Then promotions. There are some drugs that are promoted. The local ones in particular, things like marijuana, cannabis. There are people who promote. Celebs in our countries, singers talk about this and promote in the various songs, and unfortunately appeal to young people who eventually start using these substances. We have what we could refer to as the most at-risk populations in our regions. The internally displaced people, I talked about this since many times. Many countries are at war, they have conflict, so we get people, unfortunately, getting these problems, and they are a group that is at risk. Refugees are there all the time, from moving from one country to another, the migrants, people in conflict areas, street children. This is a phenomenon that is quite heavy in Africa. A lot of people running from their homes and going to the streets to beg and do drugs and commit crime and lots of other things. Then the women and the people that are living with AIDS. These are also a population at risk. Now, of course, the consequences of all this is that all government efforts on the continent and in many countries get undermined because of the issue of drugs. Poverty remains disturbing large sections of the populations. And you find that in many African countries, national health care systems lack the resources to offer treatment to people that are addicted to drugs, let alone, of course, even the other common diseases. Of course, that would mean that drug problems continue, crime continues, because drugs and crime tend to go together, corruption, high disease burden, and civil strife, because if really there are areas that are not well managed politically, then civil strife very easily comes in. So what have been the responses? True, a lot of responses have come in, global, regional, sub-regional, and national, and all these really have been geared towards supporting this region to deal with the issue of drug abuse and support treatment and rehabilitation. UNODC, of course, has been one of our key supporters at various levels, like we can see, partly support directly to the countries, but also through other structures. I know African Union has been supported a lot to offer interventions in the region. TreatNet was a major innovation, and it did support a lot in the area of improving treatment and care for people that are addicted. There are some people in here that were master trainers. I was one of the master trainers, and we did do a lot of work, especially in Eastern Africa, where I was supporting training. We trained people from over, I think, 10 countries in the region, and clearly now following that, the situation is not the same. There's been a lot of improvement in the way treatment is looked at. There have been various youth programs. There was the networking program for the youth, which is still running in some countries. The youth working together to support prevention programs. Then there was the peer-to-peer prevention program. We got supported in the region to develop a curriculum that we implemented in countries in Eastern Africa, and that is still running and supporting young people to prevent drug abuse, especially the ones that are out of school. Yesterday we were looking at the issue of who can best do offer health education. If an old man like me, bald head or gray hair, goes to talk to young people about drugs or abuse, would they take me seriously, or they would take their fellow young person more seriously than a person like me? So I think those were the things that that project looked at, and I think it has made a lot of difference. The Sustainable Livelihood Project, again coming from the center here in Vienna, in various countries, supporting young people at risk of developing drug problems or HIV/AIDS to have activities that they can do to sustain themselves through various forms, maybe carpentry or tailoring or baking and so on and so forth. So this was a very good program that empowered young people to lead sustainable lives, and of course to keep away from drugs and risky behavior that could probably introduce them to HIV/AIDS. Many other demand reduction programs and supply reduction activities were taking place. I know there are some people here from the African Union, and we want to appreciate African Union because African Union has helped bridge the gap between the politicians in countries and the service providers in terms of, or stakeholders in terms of prevention, drug prevention and treatment. Now they have made politicians incorporate drug abuse prevention and treatment in their programs, which is really something very, very good coming from that level. Now, because of that, there have been a number of national responses. Many countries now have the commitment to deal with drug abuse problems and offer treatment. There is a good political will in many countries. There are policies and programs that have been developed in the areas of prevention and treatment, which was not the case before. And now a number of countries are putting up what we can look at as a good practice in the region. For example, when you look through, in the region, the Eastern Africa region, we even sat and agreed on what should constitute good practice. And we identified a number of things that we feel should be included as constituting good practice. And we want each and every country within our sub-region to follow these guidelines, and already some of them are following. Issues of strengthening partnership between civil society and government, good coordination between HIV/AIDS and drug use, empowering users, availing drug observatories. Like we said, data is an issue. People are not seriously taking this. So when every country creates a drug observatory, then that observatory will help to give data about the situation in the countries. And already these are running in some of the countries. I'm sorry I have to rush, but these were some of the good practices. Others are high-level coordination, creating institutional policy and legal framework to deal with the problems, provision of detox and rehabilitation centers, and apparently also beginning to offer OST. This was initially an issue of contention in some countries, but I think the beauty of science is that it has helped us to inform others to appreciate the need for people that require these services to have them. So that's already happening. Integration of HIV/AIDS in drug abuse management should be happening. And the decriminalization of people who inject drugs. So I think we've taken that to be also very, very good practice. We have lots of opportunities that we shall take advantage of. The political reforms, global regional support from WHO, Global Fund. Apparently, Global Fund is supporting OST programs in many countries in the Eastern Africa region. Of course, the only problem is that this is external donor funded. What we are now struggling for is to have domestic funding for these projects to make them really sustainable. Uganda, I will not talk much about it because of the time has run out, but it basically follows the guidelines that have been put forward by the sub-region, and that's what we are using to improve situations. In my conclusion is that as a region, as a sub-region, I think we currently know where we are. We've set ourselves probably in the right direction. We know where we are going, and hopefully with the support of everybody, we shall get where we want to go. I thank you so much.